hair loss in men. Fortunately, this audience, every man has an excellent head of hair, so I'm going to move on from this topic. So, hair loss in men occurs in 100% of men. So you're not alone. Take a look to your right, take a look to your left, right? You're not alone. So it commonly starts in your early 30s, sometimes even in your 20s or even in your teens. And I have 21-year-old guys in my practice every single day telling me, "Doc, what can I do about my hair loss?" Right? So very, very common problem. Unfortunately, treatments for hair loss in men clearly are not that great. Otherwise, everybody here would have a great head of hair, right? So clearly are not that great. So what are our options for hair loss in men? Number one, Rogaine. And I talked about that for women with hair loss. And for some reason, it tends to be better in women than it does in men. It doesn't work as well in men. All right? So let's just go over the pathology of hair loss in men. You haven't lost the hair. They've just been miniaturized. The follicles are still there, and the hairs are still there. They're just microscopic. So they're not big, huge follicles like this. Now they're a little follicle like this. So the hairs are microscopic as they're coming through. And it's hormonally mediated. Testosterone causes hair loss. So if we cut off your testosterone supply, you'd have a great head of hair. But clearly we can't do that. So what can we do? We can use things to try and increase blood flow to the scalp. So Rogaine is a product applied onto the scalp. It dilates blood vessels, increase nutritional supply to the scalp, and you can get some benefit. Not great though. Don't jump up and down. Don't everybody run out and buy Rogaine today. Success rate in men, probably less than 1%. So 1% of men can get not more hair, but can maintain what they have. All right, 1%. Next option, Propecia. Some of you may have heard of Propecia. This is a pill, also known as finasteride. Some of you may be on finasteride or a derivative of finasteride. This is used in older men for the treatment of big prostates. Another thing that happens to 100% of men is that our prostates get bigger, right, as you get older. So finasteride is a hormone inhibitor, inhibits the conversion of testosterone to its active form. So when you take the finasteride, it shrinks your prostate because it's a hormonally mediated growth. As you get older, it just grows. The same hormone and the same receptor, we talked about that earlier, not only acts in the prostate, but also acts in the scalp. So most good discoveries in medicine are done purely by accident. 30 or 40 years ago, when they were doing the finasteride experiments, they found that some of the men who took finasteride, they got more hair. Said, hey, wait a minute, maybe we can make more money off this drug by selling it for hair loss and not just for big prostates. Right? So it's been actually on the market for quite a while, for about 20 years, and they've had to change the dose a little bit, decrease the dose for hair loss versus prostates, and it does work. But again, the numbers aren't that great, I'm sorry. So instead of 1%, now we jump up to about 5 or 6%. So taken in conjunction, finasteride plus Propecia, maybe we can get up to 6 or 8% of men can actually get decreased in hair shedding. That's as good as it gets. Doesn't get any better than that, unfortunately. So all of these things that you go online and you read, we can give you new hair, more hair, laser this, and all that stuff, all an absolute waste of your money. Don't even bother going there because you'll be wasting your money. So if you have a son who's saying, you know what, Mom, Dad, I'm losing my hair, I saw this thing online, it's only $10 million, and I can get all my hair, don't mortgage the house. It's not worth it. It's a waste of your time. Go see your doctor. Maybe one of these options may be useful. Unfortunately, really the only option that works well is hair transplantation. I used to do hair transplant in my practice. It actually works very well. I don't do it anymore, but it actually does work very well. The drawback, of course, is cost. It could be anywhere up to $5,000, $10,000, $15,000 for one session. So you can get some decent changes with hair transplantation. Essentially what a hair transplant is, taking hair from the back of the scalp and moving it to the front of the scalp. That's all it is. Taking the hair, a strip of hair, cutting it into individual little grafts, and putting it in surgically onto the front of the scalp. The hair on the back of the scalp, for some reason, God has made it such that that hair doesn't fall out. It's called geography, scalp geography. So the geography of the hair on the top of the scalp is that it's hormonally sensitive. The hair on the back of the scalp and on the sides of the scalp is not hormonally sensitive. Fascinating. We don't really know why that is. Don't know if there's any embryologic reason or any genetic reason or any developmental reason for that to happen, but just one of those things. So we can take the hair from the back of the scalp and put it on the front of the scalp and it'll never fall out. So if that's an option that you want to consider, very, very effective. All right? So hair loss in men. I see around this audience, and I suspect that a couple of people may use black hair dye. in their scalp. Now, black hair dye. Hair dye allergy, very, very common. Probably 1 in 5 individuals has an allergy to hair dye. You may not even think you have a hair dye allergy, but you're able to tolerate the irritation or the itch or the burning or the rash that you get from it. But if you have any of those things, I'm sure you suspect that maybe you have an allergy to hair dye, but I don't want to let my hair go gray, so I'll dye my hair. The issue is, if you do suffer from any of those issues when you dye your hair, you may be putting your scalp at risk and running the risk of losing your hair in the long term. Because when you get any of those symptoms when you dye your hair, you're increasing inflammation in your scalp, and inflammation is the bad guy. That's why we lose hair in the first place. You get inflammation in the scalp, and inflammation means those white blood cells that are there are chewing up the hair follicles. And when they chew up the hair follicles, that causes hair follicles to fall out. So you get inflammatory hair loss. So hair dye allergy, very common, and I see a lot of cases in my practice where individuals have developed hair loss from chronic use of black hair dye in the scalp. All right? So be aware of that next time you think about dyeing your hair, especially if you have any of these symptoms. 1 in 5, so 4 out of 5 of you are safe.
Is it only black or any other color?
Dark hair, so dark hair dye. So blonde, no, but brown, dark brown, and henna. So henna makes your hair orange, that funny orange color, right? But they say, no, use our henna, it's black henna. It's safe. Black henna is the same as black hair dye, because the ingredient is called paraphenylene diamine, PPD for short. Black henna has PPD in it, and PPD is the bad guy. PPD is what causes the inflammation and causes the hair loss. So don't be duped into thinking that black henna is safe. So if you don't mind having orange hair, by all means use henna. Right? But black hair dye and dark brown hair dye, unfortunately, have PPD in them, and they are not good, especially if you suffer from any sort of symptoms after you use it. You should have really no symptoms after you dye your hair. So if you have irritation or burning or pain or itch, then think about inflammation and possible long-term consequences with regards to hair loss. All right? So black hair dye allergy, the only real solution, unfortunately, you know, I don't need to tell you that. Excess hair growth. So, you know what? It's hardly fair. We lose our hair here, but we get too much hair everywhere else. Like, come on, really? But unfortunately, this is another problem. Hirsutism, we call it. So excess hair growth. There are 2 types of hirsutism. One that is ethnic and racial. So if you're South Asian, you're probably hirsute, right? It just happens. We all develop excess hair on the face, men and women. So hirsutism related to our ethnicity. Common in people from the Middle East, Southern Europe, South Asians, we're all in that same category. We have hirsutism. The other is medical hirsutism. Is there an underlying hormonal cause for this hirsutism? All right? So the top is an example of ethnic hirsutism. Very, very common, fine little, we call them vellus hairs, fine little hairs on the face. All right? This is a female, and this is an example of medically significant hirsutism. Unfortunately, sometimes this can happen even in the absence of any hormonal abnormalities. So if someone has significant hirsutism, I think is important, especially in the presence, in females I mean, especially in the presence of abnormal menstrual periods, very important that they be investigated for a variety of conditions that can be associated with their excess hair growth. And the treatment for their hair growth may be to normalize their hormones, to go on to certain medications to normalize their hormones, and that can help the excess hair growth. So important to think about excess hair growth in the presence of abnormal menstrual cycles. And there are a bunch of treatment options for this and for this. Treatment options including waxing and plucking and all that stuff, lasers. There is a cream, you can talk to your doctor about it, called Vanica cream. It's relatively new. It actually works really well. It inhibits an enzyme that's involved in hair growth. So you apply it a couple of times a day, twice a day, and it removes the hair cleanly, easily, and safely without any side effects of irritation or bumps from plucking or waxing. So Vanica cream, it's not covered by any plans, or if you have a really good plan, maybe it's covered, but most drug plans don't cover it because hair is cosmetic, of course. But it might be an option to try if you have excess hair growth and you don't want to go down the route of laser. I do a lot of laser in my practice. I have about 8 lasers in my practice, one of which is a laser hair removal machine, and I do a lot of laser, but lasering dark hair on dark skin is complex because lasers work on pigment, so we got to be very careful. Typically what it means is it takes a lot of treatments. We can't turn the laser up really aggressively. We've got to go relatively gently as far as the fluence, the energy level on the laser, because we don't want to burn the skin, so we got to go gentle. But it can be useful. I do not recommend laser hair removal in females below the age of 16. So you have to be at least 16 to think about laser hair reduction. But if you're a young 16, if you're 16 and your body type is a 14-year-old, we still don't do laser. You need to be a fully mature woman before you do laser hair removal, because the hair doesn't sit in the right spot in the skin. All right? So important to bear that in mind. Yep, 5 minutes. All right, moving on. We're almost done. Last topic, 2 slides left. Home stretch, skin cancer. So the one type of skin cancer I think that we all need to be aware of is called melanoma, malignant melanoma. And the type of malignant melanoma that people of color, like us, develop is called acral lentiginous malignant melanoma. Shows up on the hands and feet. So here's a mole on the bottom of the foot. So if you've never looked at the bottom of your foot, I recommend you do that when you go home tonight. Take a look, or on your palms. Or sometimes it presents as a pigmented streak in the nail. A pigmented streak in the nail. It's not unusual for people of color to have a bit of pigmentation in their nails. But a new onset pigmented streak on your nail is unusual, and that needs to be investigated. So investigations involve taking a little biopsy from this portion of the nail, just in that area here, to try and figure out what's going on. All right, so this could be something significant, Furthermore, this could be something significant, having a dark mole on the foot. This could be something significant, having a dark mole on your back. So if you've never looked at your back, get a look at your back. Use a couple of mirrors, get your spouse, somebody, take a look at your back. Husbands are usually useless at looking at their wives' backs. Because if we look at it, say, you look fine. We're not even looking. Wives, on the other hand, are excellent at looking at their husband's back. So for all you wives, I'm a husband, so for all you wives, I recommend you look at your own backs. All right? Get a couple of mirrors, a good full-length mirror, and a good handheld mirror. You can get a good look at your back. Everybody has an iPad. If you've got a lot of moles, take a picture. So take a picture, that way you have a baseline. At our age, once you're over about the age of 35 or 40 or 50, what you've got is what you've got. So if you develop a new mole or an existing mole is changing, that is abnormal, and that should be investigated. Someone should take a look at that mole. None of us are protected from skin cancer. Each one of us could develop skin cancer. And the older we get, we're at a greater risk for developing all kinds of cancers, including skin cancers. So take a look at your skin, photograph, and look at your back, especially palms, soles, and your nails. Final slide. Oral cancer. I'm not a dentist, but I do see a lot of oral cancer in my practice. And oral cancer is the domain of South Asian males. And this is related to chewing pon. And unfortunately, betel nuts and betel leaves and anything to do with pon, highly carcinogenic. Worldwide, there's probably about 120,000 deaths annually from oral cancer. Almost half of these are from India, or among South Asians, if you can believe it. Of course, we populate almost half the world, so no, we don't. We populate about 20% of the world, right? So it's actually 150% greater risk of developing oral cancer among South Asians than there are in non-South Asians. It's devastating. And it happens in young men. So the biggest culprit is a man between the ages of 20 and 40. Very, very, very common. 10 times worse than smoking for developing oral cancer, chewing pon. So if you know someone who's chewing pon, tell them to start smoking, maybe. Don't start smoking, but stop chewing pon. Pon is terrible, horrible. So having it once in a blue moon, that's one thing, but chewing it regularly, very, very, very bad with regards to development of oral cancer. So if you or someone you know has a persistent sore in their mouth or something that's just not right in their mouth, or that halitosis, bad breath all the time, they could have an early sign of an oral cancer. So make sure it gets looked at. When you go see your dentist, make sure they look at the mouth, not just at the teeth. Make sure they look in your mouth. Look in your mouth. When you go see your doctor, when they listen to your chest and listen to your lungs, have them look inside your mouth. Stick a flashlight in your mouth, because things can hide in your mouth, behind the teeth, in the back. Sorry, yeah, go ahead.
According to my uncle, who is a famous radiologist, cancer of the cheek is almost unique to India, and it comes from Penny, of course.
Yeah.
Is that only found amongst Indians?
No, it's not only found amongst Indians, but it's found commonly, most commonly among South Asians, because of what we do inside our mouth, right?
Exactly.
Right. So you stick it right in there, and you hold on to it right there. right? So chewing tobacco also increases the risk, but it's far greater risk using betel than it is with tobacco even, as far as oral cancers.
Tobacco only existed in the 19th century.
No, a lot of people still chew tobacco. Absolutely, baseball players. If you watch a Blue Jays game, check it out. Half of them are spitting tobacco off the side. Very common in North America for chewing tobacco. Not so much in Canada, but in the southern United States, very common to chew tobacco actually. So chewing tobacco also. So you've got a focus of carcinogenic material sitting in the mouth. Very common. So beware of non-healing mouth sores. If you or someone you know chews pond, tell them to stop. Thank you.
I thoroughly enjoyed the presentation. I'm sure you'll agree with that. The style of speaking and the slides are lovely. And I just want to recognize many. Now, we have only 7 minutes for questions. And please go ahead. Quick, short one, please, only one.
I got a perennial itching on skin. Got treated from Russia, China to California. It doesn't show up, but when I itch, this is what happens. Right. I went to hundreds of dermatologists, but conclusion one gave is I have got pruritus. I think I'm right or not?
Pruritus, yeah.
Pruritus I have got.
Right.
It moves all over the place.
Right.
Becomes like this, and
Right.
it vanishes in 2-3 days.
Right.
Any cure?
Right. So first of all, the marks that you've got are bruises from scratching.
Yeah, I know, yes.
That's aside. There are some things that your doctor may be able to give you to help with the bruising. There's a vitamin K cream which can actually help with bruising. Itching as we get older, common problem. Tends to be worse in the winter than it does in the summer. So humidity, as we get older, our skin doesn't retain moisture properly. So very, very important to bear that in mind. Itch is usually worse on the extremities, arms and legs. The body is humidified because you wear tight clothing, underwear and stuff like that, so you're humidified. Arms and legs tend to get dry. So most important is to turn the humidity up in your house. Put a humidifier in your bedroom, that's important. Put a humidifier on your furnace if you don't already have one. Get a water softener, because in Northern Ontario, Ottawa, water's very hard here. We're at the border of the Canadian Shield, water's very hard. So get a water softener, that's important. Lubricate, moisturize, that's very, very important. You can use cortisone-based creams, that can be helpful as well. But if you do some of these other things, that can be helpful to settle your skin down.
Shiv Chavda? Shiv,
There's no cure.
your question?
No cure.
There's no cure.
Okay.
You didn't talk about papillomas at all and Botox.
That's another lecture, absolutely. That's half my practice, Botox and skin tags.
But papilloma certainly.
Papillomas, like so, warts, you mean?
Warts.
Warts, right. So warts, very, very common problem. You know, I had a short amount of time, but that would be another topic, but thank you, yeah.
Okay, please, I'll come
Could
to
you
that.
please explain how keratosis pilaris can be treated?
Keratosis pilaris, common problem. Some of you may suffer from it, and children certainly suffer from this. These are little bumps that you see on the arms and legs, so here. The reason we develop keratosis pilaris has to do with hair growth. Hair, instead of growing up straight, because of hormones, usually around the age of 13 or 14, the hair starts to grow up like a corkscrew. When it goes out like a corkscrew, it pulls a hair follicle out with it and forms a little bump. Good news is the vast majority of kids grow out of it. Bad news is there's no break treatments, but there are 2 options. One is vitamin A-based creams, can be helpful. And 2 is use salicylic acid in a moisturizer base. So I alternate using vitamin A at night and a salicylic acid in a moisturizer in the morning. And can be very useful, and using a loofah brush after a bath.
Okay, next question.
My question was around this time of year, I usually get red blotches and dots on my ear and on my face, and what's to do? Because we've tried many creams and
Is it itchy?
it's sometimes itchy, but they come around winter and then summertime, when I'm in the sun, and red blotches everywhere.
Do you play a lot of sports?
I played just a few sports, but
There's a few sports. Okay, sounds to me like it's a problem with the sweat glands. So dry skin on the surface, and the sweat's not coming out properly. So there's a condition called miliaria rubra. Rubra means red. Miliaria is sort of engorged glands in that area. So that's probably the problem. In fact, it's probably related to the skin being a little bit on the dry side. So same as this gentleman, yeah.
So, the doctor prescribed hydrocortisone with glycobase and everything?
Yeah, no, see that doesn't necessarily work. What you need to do is increase humidity in the skin to begin with. So So I'd put a humidifier in his bedroom. Put a humidifier in his bedroom, especially in the winter, humidifier in the bedroom.
Margaret,
That'll make a difference.
Quick question.
go ahead.
I never used to use sunscreen, but I started using since 2 years. But I have a hard time to which one is the best. What do we see in sunscreen?
Whatever's on sale. 30. The key is a 30. 30. I mean, you have to pick what you like. There are a whole host of sunscreens.
No,
There's
but
gel.
what do you pick in it? Like they have, say, UV.
You want broad spectrum coverage, UVA and UVB, so you want broad spectrum coverage, and an SPF 30 or higher. Those are the two things you look for. But really, frankly, it doesn't matter, but there's different aesthetics to different sunscreens.
Glasses.
Yeah, I want to ask about hyperpigmentation.
Hyper, yep.
Yeah, there are lightning creams,
Yeah.
but they work very, very, very slowly.
Yes, you're right.
So how long, we need to apply for any significant change?
Right. So it depends on your, I mean, we talked about some cases of hyperpigmentation. Not all cases of hyperpigmentation respond to lightening either, all right? So there are prescription strength lightening creams and over-the-counter lightening creams. So you might want to see your doctor, get referred to a dermatologist to get something that has a prescription strength level of skin lightening in it. Failing that, then there's other options. If it doesn't work, let's say within about 3 to 6 months, then there are other options, lasers and chemical peels and things like that that can be useful. But that sort of stuff you'd have to pay for. But typically I would recommend using it for 3 to 6 months before you say, you know what, this isn't working. And there are a variety of different categories of lightening as well. So just because one category doesn't work, that doesn't mean something else isn't going to work. So you have to exhaust all of those before you give up. But 3 to 6 months typically.
Okay, next.
I have my grandson, aged 7 years of age, and he has 2 or 3 spots over it with the light color.
2 or 3 little
size
spots?
would be like this nail size.
Right.
So
Just localize on his right cheek.
yes,
3 little spots.
yeah, 2 or 3,
How old is he?
7 years.
7 years. All right.
So
And how long has he had it?
how long is that? 3, 4 months.
3 or 4 months. Is it white or off-white?
Off white.
Okay. He needs to see somebody, I think. Yeah. So it's hard for me to tell exactly what it is. There are a few possibilities, not just vitiligo or pityriasis alba. There are a few other things that it could be.
Okay.
So I think he really should see a dermatologist. So there's a couple of possibilities. I can't really say off the top of my head what I think it could be. I'm sorry.
Well, excellently presented.
Thank you.
Very well articulated,
Thank
as my professor did. The only question which I'll ask you, whenever we think of skin, we think of vitamin D,
Right.
especially nowadays.
Absolutely.
Whenever you can take blood exam, they say you lack vitamin D.
Right.
So I thought you would be covering about the formation of vitamin D complexes, D1
Right.
to D5.
The reality is, even if you covered 100% of your skin and you left your eyes open, you get enough sun exposure for vitamin D through your iris. That's the frank reality of it. So we all think, oh my God, I'm wearing sunscreen, I'm not going to get enough vitamin D. Crap, right? You get enough sun exposure through your eyes. So look for dietary supplementation of vitamin D. Take vitamin D supplements, absolutely, because we don't take enough vitamin D. But enough sun exposure occurs through the eyes to convert it from D1 to D3.
But this vitamin D, is it D3, D1, D2?
D3 is the active vitamin D. D3 is the active vitamin D.
Let me answer this question. This question of vitamin D, I think you should know it. We covered this subject here in details. And there was a scientist here who did study. Some of us participated in this study, and the conclusion of that study was South Asians with dark skin, they don't make vitamin D. That was the conclusion. And he recommended that we should be taking vitamin D3. So that was the general recommendation. At that time, we covered the subject of vitamin D in general. Now you know vitamin D3 is not the active form. It has to be converted into active form. And there are 2 places in the body where it is done. Firstly, it goes to the liver. So it becomes, there is a molecule, it becomes 25. The position 25, hydroxy cholecalciferol, that's a long name, but that's vitamin D3, and it's converted at the 25th position. It's still not active. then it has to go to the most important organ in the body, and that is the kidney. And there it is converted into the most active form, and that is one position, first position, along with the 25th position, so 125 dihydroxy polycalciferol. So that's the active form, and we covered this subject in quite details over the last couple of years ago. So vitamin D is a problem in most of our community, and it's good to get it checked out. Please go ahead.
I didn't hear the word leukemia. Can one of those conditions that you have mentioned in your speech be mistaken for leukemia or vice versa?
No, not for leukemia, no.
I think
Although there is a condition called cutaneous T-cell lymphoma, CTCL, and in darker skinned individuals you can get and it typically looks red and angry in Caucasians, but in darker skinned individuals you can get a lighter variant, a white variant of it. Doesn't quite look like vitiligo, but sometimes if you didn't look at it carefully, it might be misjudged as being vitiligo and not lymphoma. Leukemic infiltrates in the skin look different. They're very, very different. And none of these things predispose you to leukemia. None of the things I've spoken about anyways. Yep.
Great presentation, super. I was going to ask you, some adults have signs of those, what do you call it, the black mold?
Skin tags or whatever,
Skin
yeah.
tags, they keep coming even now, like
Yep.
towards the age of 40 or whatever.
Absolutely.
Is that something to be concerned about?
Nothing to worry about.